Pause for a moment. Sit down and roll up the legs of your pants. Take a careful look at your calves and ankles. If you notice purple discoloration, a web-like marbled pattern, veins appearing like blue streams beneath delicate skin, or darker areas around the ankles that resemble bruising, then the information ahead deserves your attention. What you are seeing is not simply poor blood flow. It is not merely a consequence of getting older. It is not something to accept because previous generations lived with it for decades. Instead, it points to a clearly identified and potentially reversible problem occurring inside the legs. If ignored beyond the age of 65, this condition may contribute to long-lasting wounds that struggle to heal, blood clots capable of reaching the lungs, and severe limitations in mobility during later years of life. There is also an important detail that often does not fit into a brief medical appointment. Research in vascular medicine, including work associated with Harvard, the Cleveland Clinic, and peer-reviewed publications, points toward a simple evening routine lasting 5 minutes that targets the underlying cause of purple legs rather than merely addressing what appears on the surface. By understanding what is taking place inside the veins, why many people never receive a detailed explanation, and which 3 actions can begin immediately at home without cost, the situation becomes much clearer. Inside every vein are tiny structures known as valves. Imagine them as one-way doors. They open only in a single direction. Whenever the calf muscles contract during walking, standing, or foot movement, these valves open and help move blood upward toward the heart. As soon as the muscle relaxes, the valves close. Their purpose is to stop blood from flowing back down toward the feet. The process repeats continuously throughout life. Open, close. Open, close. Thousands of cycles every day. After the age of 65, however, those valves may begin to weaken. The change is usually gradual rather than dramatic. One valve becomes less effective, then another follows. Instead of sealing completely, the valve allows a small amount of blood to leak backward whenever the surrounding muscle relaxes. That backward flow begins collecting in the lower veins. The vessels beneath the weakened valve expand. They stretch. Their walls become thinner. Additional valves farther down experience greater strain. More leakage develops. More blood accumulates. Eventually, a person looks down and sees purple skin changes, marbled patterns, and prominent veins. This condition is known as chronic venous insufficiency. According to the Society for Vascular Surgery, approximately 1 in 3 adults over age 65 in the United States is affected. That means 1 out of every 3 people in that age group. Many individuals hear that the issue is simply varicose veins or circulation slowing with age. They may receive compression stockings, a topical cream, or general advice to elevate the legs. Yet the deeper problem involves why the valves fail in the first place. The valves do not stop functioning solely because of age. 3 distinct and identifiable factors play a role. Each of those factors can be addressed. The first factor involves the calf muscle. Many vascular specialists and cardiologists refer to the calf as the body's second heart. Some even call it the peripheral heart. Every contraction of the calf helps drive venous blood upward against gravity. When this muscle remains strong and active, it performs roughly 30% of the work required to return blood from the legs back to the heart. But after age 65, many daily routines involve extended periods of sitting. Breakfast is often spent seated. Time in the car is spent seated. Television viewing happens while seated. Dinner is eaten while seated. Even the hours before sleep are frequently spent sitting. A muscle designed by human biology to remain active for much of the day becomes largely inactive. As the calf muscle contributes less, the valves lose a major source of support. The pumping action decreases. Blood begins accumulating in the veins. The valves must withstand the force of gravity on their own, day after day, without adequate assistance from the muscle beneath them. That is the first reason. The second factor involves blood thickness. A large number of adults over 65 live with a mild but persistent level of dehydration. It is not severe enough to cause collapse or obvious symptoms. Instead, it develops quietly because the sensation of thirst often becomes weaker with age. As a result, many people do not consume enough water to support normal blood flow. When blood becomes thicker, movement through the veins slows. The valves must work harder to move it. Vein walls may stretch further to accommodate the reduced flow rate. Over months and years, that added strain can weaken and distort the valve structures until they no longer close properly. Research published in the Journal of Vascular Surgery reported that individuals diagnosed with chronic venous insufficiency showed significantly higher blood viscosity compared with age-matched control groups. The word significantly is important because it indicates a measurable difference observed within the study findings. The second issue can be addressed as well. Now comes the third factor, and it is rarely discussed. Beneath the skin lies a network of connective tissue known as fascia. This layer surrounds every muscle, vein, and nerve throughout the body, forming a delicate web-like structure. When fascia remains healthy and properly hydrated, movement occurs smoothly. Veins move freely within it. Muscles move freely as well. The entire system functions with less restriction. After age 65, inactivity, dehydration, and inflammation can change that environment. The fascia gradually becomes less mobile and more adhesive. Veins running through it experience increased pressure. The lymphatic vessels responsible for removing excess fluid leaking from the veins also become compressed. As a result, fluid accumulates. Pressure increases. Veins enlarge even further. These three factors, an inactive calf pump, thicker blood, and restricted fascia, do not operate independently. Each one worsens the others. In most older adults who develop purple discoloration in the legs, all three are present simultaneously. The encouraging news is that a simple 5-minute evening routine can target all three mechanisms. It requires no supplements and no special equipment. A wall and a glass of water are enough. Before describing that routine, there is an important warning. If purple discoloration in the legs occurs together with any of the following signs, medical evaluation should not be delayed. The first warning sign is skin around the ankles that has become brown, hardened, or leathery in appearance. This condition is called lipodermatosclerosis. It indicates that chronic venous insufficiency has progressed significantly. Oxygen delivery to the skin has been reduced, and tissue damage is beginning to occur. The second warning sign is an open wound or sore located on the ankle or lower leg that has remained present for longer than 2 weeks. Venous ulcers are well known for healing slowly and frequently becoming infected. They represent one of the leading reasons for hospital admission among adults older than 70 years of age. Even a small ulcer warrants consultation with a vascular specialist. The third warning sign is sudden swelling affecting only one leg, especially when accompanied by warmth, redness, or pain in the calf. This pattern is a classic indication of deep vein thrombosis, a blood clot within the vein. If that clot separates and travels to the lungs, it becomes a pulmonary embolism. This condition ranks among the most common causes of sudden death in people older than 65. New swelling on one side, together with calf pain, should be treated as a medical emergency. Immediate evaluation at urgent care or an emergency department is necessary. The fourth warning sign is leg swelling occurring together with chest pain or shortness of breath. This combination may suggest heart failure or a clot that has already migrated. The recommendation remains the same. Seek medical care immediately. These warnings matter because purple legs are often not an emergency. However, in some situations, they represent the earliest visible indication of a serious condition. Knowing the distinction is important. For those whose symptoms developed gradually over months or years and affect both legs, the following routine is intended to address the underlying mechanisms. This routine targets calf muscle function, blood viscosity, and fascia mobility simultaneously. The entire process requires 5 minutes and is performed once each evening, ideally about 30 minutes before bedtime. The timing is important. The first step begins with water. Before any physical activity, drink 1 large glass containing 12 to 16 ounces of water at room temperature. Avoid ice-cold water. Consume it gradually over approximately 2 minutes while sitting quietly or reading. Its purpose is simple. Overnight, it helps reduce blood thickness so that the valves activated during the routine can move fluid more efficiently rather than pushing against greater resistance. Anyone taking a diuretic should discuss evening hydration with a physician. For most older adults, this timing is appropriate. Individuals with heart failure or certain kidney disorders may require adjustments. The second step is called the wall drain. Lie on your back, either on a bed or on the floor. Move close to a wall and raise both legs against it until the body forms an L shape. The back remains flat. The legs extend vertically along the wall. The heels point upward. Remain in that position for 2 minutes. During those 2 minutes, Gravity changes roles. Instead of working against the veins, it begins assisting them. Blood that accumulated in the lower leg starts returning toward the heart. Lymphatic fluid trapped within the fascia is encouraged upward through vessels that have spent the day under pressure. Vein valves that have endured approximately 16 hours of stress receive a period of relief. Research published in the Journal of Wound Care reported that 15 minutes of leg elevation performed twice daily reduced lower leg edema by an average of 23% among older adults living with chronic venous insufficiency. This routine uses only 2 minutes, but it is repeated every day and combined with additional actions designed to strengthen the overall effect. While the legs remain elevated, perform one additional movement. Point the toes downward, then slowly pull them back toward the face. Repeat the motion up and down 20 times. This exercise is known as ankle pumping. It activates the calf muscles while gravity assists fluid drainage. In effect, the body's second heart is being engaged with support from gravity. The third step focuses on releasing fascia. Lower the legs and sit either on the edge of a bed or in a chair. Place one ankle over the opposite knee. Using both hands, hold the calf muscle firmly. Use a firm grip on the calf muscle, not light pressure. Apply moderate force and slowly move both hands from the area behind the knee toward the ankle. Then travel back upward and repeat. Continue for 60 seconds on each leg. The purpose of this movement is to separate layers of fascia that have become restricted over time. Normal sliding motion begins to return. Pressure on the veins and lymphatic channels decreases. Many people report hearing small crackling or popping sensations the first time they perform this technique. Those sensations are associated with fascia releasing tension. They are not considered harmful and indicate that the tissue is beginning to move more freely. The final step is another activation of the calf muscle. Stand upright and hold a sturdy chair for support if needed. Lift yourself onto the balls of your feet. Remain at the top position for 2 seconds. Lower yourself gradually back to the floor. Repeat this movement 20 times. Move slowly. Stay controlled. This is the direct activation of the body's second heart, immediately before sleep. Why is the timing important? Because the next 8 hours are spent lying horizontally. In that position, gravity becomes largely neutral. Vein valves experience their greatest period of rest. The blood that has been diluted through hydration, the fluid that has been encouraged upward through leg elevation, the fascia that has been loosened through manual release, and the calf pump that has just been stimulated all continue working together during sleep. The result is often less swelling, reduced heaviness, and a decrease in purple discoloration by morning. The entire process requires only 5 minutes each day and costs nothing. It is important to understand what changes can realistically be expected. During the first week, many people notice that their legs feel lighter when they wake up. Socks feel less restrictive. Evening swelling around the ankles often becomes slightly less noticeable. Between the second and third week, visible discoloration commonly begins to lessen, not disappear, lessen. The marbled appearance becomes softer. Prominent veins may appear less raised. Others may not immediately recognize the difference, but the person performing the routine usually does. By 6 to 8 weeks, individuals who have followed the routine consistently every evening often observe measurable improvement. Skin color appears more uniform. The sensation of heaviness is absent for much of the day. Walking becomes easier. Climbing stairs becomes easier as well. A useful way to monitor progress is through photographs. Take a clear picture of both legs side by side under good lighting conditions. Save it in a phone folder labeled Legs Week 1. Take another photograph after 4 weeks, then take a third after 8 weeks. Comparing the images often reveals changes that are difficult to notice when looking at the legs every day. Photographs can show progress more clearly than memory alone. If 8 weeks pass without any visible improvement, that may suggest a more advanced condition. In that situation, consultation with a vascular specialist is recommended rather than relying solely on a primary care appointment. Request a referral and ask about a venous reflux ultrasound. This examination measures whether the vein valves are leaking and determines the degree of leakage. It is non-invasive, requires approximately 20 minutes, and is covered by most insurance plans. With those results available, a vascular specialist can determine whether the conservative routine is sufficient or whether a minor intervention such as valve ablation should be considered. For those wishing to strengthen the effects of the 5-minute routine, 3 additional strategies are frequently supported by vascular research. The first is walking after every meal. Even 5 minutes can be beneficial. Even a slow pace can help. Walking activates the calf pump at a time when blood vessels within the digestive system are already expanded. This helps reduce the tendency for excess blood volume to collect in the legs. The second recommendation is to avoid crossing the legs while sitting. For many people, this is a lifelong habit. However, placing one leg over the other can compress the femoral vein in the upper leg. In older adults with valve insufficiency, repeated compression occurring day after day and year after year may contribute to progression of the condition. Instead, sit with both feet resting flat on the floor. The third recommendation involves foods commonly associated with naturally supporting healthy blood flow. Examples include garlic, ginger, cayenne, dark leafy greens that contribute to vitamin K balance, and fatty fish consumed twice each week as a source of omega-3 fatty acids. These foods are not substitutes for medication. Anyone taking blood-thinning medication should never discontinue a prescribed treatment based solely on information from a video. However, for individuals not using anticoagulants, a diet containing these foods together with adequate hydration may help support lower blood viscosity. These three measures are not replacements for the routine. They serve as additions that may enhance its effects. The routine remains the foundation. Add the others when appropriate. Purple discoloration of the legs is often viewed as an unavoidable consequence of aging. Yet understanding the underlying mechanisms provides an opportunity to respond rather than simply accept the condition. Pay attention to changes. Monitor progress. Discuss concerns with qualified medical professionals. Ask informed questions. Take an active role in protecting vascular health. If this information was valuable, share it with someone who may be experiencing the same symptoms. A simple conversation could encourage another person to recognize a problem earlier and seek appropriate guidance. Take care of your calf pump. Take care of your veins. Small daily actions can create meaningful changes over time. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.